Hello, I'm Jennifer Sale, Director of Behavioral Health at Sierra Family Medical Clinic. And this is Fred Jefferson,
Hi.
Certified Addictions Counselor from Common Goals Substance Abuse Treatment Program in Nevada City, California. And we wanted to share a little bit about our integrated program, which has been in operation now since January 2010. Prior to our integration, our behavioral health therapists were providing substance abuse counseling along with their mental health and lifestyle counseling. Although this was effective, we felt that the need was there to provide a higher level of expertise in this area by clinicians who specialized in substance abuse treatment. As an FQHC or federally qualified health center, we were unable to receive reimbursement for the services of an addiction specialist working on our staff. So we decided to collaborate with an outside agency, Common Goals, to provide these services for us. Common Goals is reimbursed by Drug Medi-Cal. All their group and individual sessions take place in the waiting room or conference room of our dental clinic, 2 evenings a week after dental hours are over. And there's also a small office available for individual assessments and counseling.
Common Goals was opened about 6 years ago by a fellow named Joe Festerson who saw a need for additional treatment options in Nevada County. Our clientele consists of a broad spectrum of people. We deal with adolescents to the adult population. We're a small agency with a family vibe to it. So when we were asked to open a satellite office up here on the Ridge, it seemed like a really good fit, and it's proven to be so. The population here could easily be neglected due to their remote location and the unavailability of public transportation. A lot of the clients up here have no license or the ability to get anywhere. So this seems like a pretty good deal for us.
All right. So the referral process with Common Goals goes something like this. When a medical provider identifies a patient with a substance abuse issue, he or she makes a referral to behavioral health for an assessment. Medical providers use a variety of screening tools, such as the MINI, the DAST, and the CALM. Following the behavioral health assessment, the therapist makes a referral to Common Goals, and if there is a co-occurring disorder, the therapist will encourage the patient to continue in therapy. Substance abuse referrals can also be made by our dentists and our care manager and our psychiatric medication specialist. For Common Goals patients who are referred from outside the clinic, the substance abuse counselor can refer to Sierra Family Medical Clinic for pain management, other medical issues, and of course mental health issues. In the medical clinic, we have been using the warm handoff model for behavioral health referrals since 2002. We believed this would also be important with our substance abuse program, as we have seen a higher level of participation when the warm handoff is made. We try to do warm handoffs as often as possible, but if varying schedules make it difficult, the therapist will leave a referral form for the patients with the patient's phone number in the Common Goals box, and Fred will phone the patient to set up an appointment. Patients are made aware of our integrated model and do sign releases so that verbal and written records can be shared.
It's been a really unique situation working up here. I've been doing this for a long time and I've never seen a group function quite like this. One of the biggest obstacles in the beginning was getting the group to trust in our agency, and once that was established, things just took off from there. One of the unique things about this group is that they move as a unit, so it's not uncommon to have our groups on Tuesdays and Thursdays, and that same group of people go out to 12-step meetings on Monday, Wednesdays, and Fridays. The other thing that's really interesting that I haven't seen much before is quite often one of the clients will call up and say, hey, can I bring a friend of mine over? They seem to be in need of some counseling or something. And the group is really receptive to that. So quite often we'll have visitors coming in, and more often than not, the visitors choose to stay in that group. I love the way this group is running up here. I love the clientele, and I'm really, really proud to be a part of it.
Wonderful.
Yeah, thanks.
All right. So in preparation for the integration of our two agencies, we had to have our dental facility certified by Drug Medi-Cal. This process included obtaining a fire clearance from our local fire district, a zoning approval from the Nevada County Planning Department, and a detailed inspection of our facility by a Drug Medi-Cal representative. Although it took about 9 months for the entire approval process to be completed, it was worth the wait. We feel this has been a very effective and needed integration of services. Referrals for substance abuse services happen more quickly and efficiently than they might otherwise, and the model facilitates good communication between the therapist and the substance abuse counselor. We have really enjoyed this integration and this collaboration.
It's been great.
Yeah.